She had tried 5 separate antidepressants. Her doctor suggested a 6th. I suggested maybe trying a different path. Look, she had tried 5 antidepressants and none of them had worked. Let me explain why and why ketamine is fundamentally different. Traditional antidepressants like SSRIs, SNRIs, tricyclics all work on monoamine neurotransmitters. That means serotonin, norepinephrine, dopamine. The monoamine hypothesis of depression started in the 1960s and suggested that depression resulted from deficiencies in these neurotransmitters. But here's the problem. About 30% of patients don't respond to monoamine targeting drugs, even after multiple adequate trials. We call this treatment-resistant depression, defined as failure of 2 or more antidepressants from different classes at adequate dosages. So if 30% of patients don't respond, maybe the monoamine hypothesis isn't the whole story. Enter glutamate. Glutamate is the brain's primary excitatory neurotransmitter, far more abundant than serotonin or dopamine. Recent research shows that depression involves dysfunction in glutamine signaling and problems with synaptic plasticity, meaning your brain's ability to form and strengthen new connections. Ketamine works on the glutamate system, specifically as an NMDA receptor antagonist. But that's just the trigger. Here's what actually happens. When ketamine blocks NMDA receptors, it causes a surge in glutamate release, which activates AMPA receptors. This triggers a cascade that increases BDNF, or brain-derived neurotrophic factor, and that activates the mTOR pathway. The result, you have rapid synaptogenesis, meaning your brain literally starts forming new synaptic connections within a few hours. This is why ketamine works fast, like days instead of weeks. You're not waiting for receptor sensitivity to slowly adjust like you did with your SSRIs. You're triggering a rapid plasticity response, and the clinical data backs it up. About 70% of treatment-resistant patients responded to ketamine, and effects can be seen within hours and often peak within 24 to 72 hours. The challenge is duration. Effects typically last days to a few weeks without maintenance. That's why integration matters. Ketamine opens that window of enhanced neuroplasticity. You need to use that window with therapy, behavior change, logs, building new patterns to make the changes durable. I mean, it's not magic. It really works well, and it works differently. So if it's something you're interested in, I highly encourage you to talk to your doctor about it. As always, if you've got any questions, hit me up.